welcome back to my channel. It's your girl SimplyKay back with another video. Today's video is highly requested at this time. So today's video is all about how being a new grad nurse during this pandemic is, my experiences, my thoughts, my tips, all that. So without further ado, stay tuned. Don't forget to like, comment, subscribe. Also, I've been meaning to tell you guys about my blog. I do have a blog. I don't post as consistently as I would like to because I like to be inspired of the heart. Before I post anything, I like to post genuine content, and when I'm feeling like I really am inspired to write, I like to post on it. So I have the link in my description box down below, so don't forget to check that out. I definitely posted not too long ago, maybe a couple days ago, and it was a post all about this quarantine time and how I'm staying positive and getting through it and my advice to everyone. So don't forget to check that out as well after you're done watching this video. Alright, bye guys. Hello! So, I think I'm gonna bring you guys with me today. So, I really want to record a video, but I don't know what to record. Hello guys, that's my jam! Seeing how this background looks, it is giving you everything. Hello! I do not want this video to be long, but there's a lot of stuff that I want to cover and talk about. So I wrote everything down so I can stay in track so I don't bore you guys half to death. So first of all, being a new grad nurse during this pandemic, first I'm going to talk about is the overall hospital environment. So when this started, it was like a whole nother time. Like, we had less patients. The unit was quieter because they weren't letting people come into the hospital unless like you really needed to be there. So we had less patients on our floor at the time in the beginning, and it was just weird. Like, we're used to being on the go, busy. No, it was like, not that we were like chilling, but it wasn't as hectic as it usually was in the beginning. So it's definitely different. All the nurses are like, this is crazy. Like, there has never been a time that the hospital's been like this. Like, all across the world, like even my friends who are nurses, like they've said the same thing. Like, it's less busier in the beginning. They weren't letting every patient in. Our visitors, for us, it started with 1 visitor per patient, and then it got to the point where it was no visitors. So no visitors are currently allowed in the hospital. That's like a big change. So it's no one in there, no patients' families, no friends coming in to visit the patients. It's just us and the patients in there, and not even a lot of patients because, like I said, they're not letting everyone in the hospital unless you really need to be there because they don't want you to be at risk. So the whole hospital environment is like, it's crazy. The next thing is, so since there was less patients in the hospital, and there still kind of is because, like I said, we're not letting everyone in unless it's necessary, we didn't need as much staff. So usually my floor runs with 10 nurses. We've been running with, like, I know in the very beginning when this all started, we would have like 5 nurses on the floor, 4 nurses on the floor. Now we're at 6, so it's like getting a little bit better, but we're not running with our full staff of nurses that we usually would before all of this happened. So they've been offering, like, calling you like, oh, you wanna be canceled for the first 4 hours or so-and-so. So you're using our PTO time because they don't need all of us there. In the beginning, I was like, yeah, like, I'll stay home, like, don't worry about it. You can cross my name off, I'll be here, I'll be home if you need me. But now I'm like, hold up, I don't got that much PTO hours, so I'm coming to work. I say no every single time now because you're gonna find something for me to do. I need to go to work. I don't have PTO hours to be using. I just kind of got here, so I only had a few. And then I was sick January, February, so I used my PTO hours then, so I don't have that much. So your girl was like, I was chilling and I was like, okay, I'll stay home. But now I'm like, I'm coming in. So that's very different because not a lot of people want to use their PTO hours. Like, that's our PTO time. That's if we get sick throughout the year. That's if we have like a vacation or we have a family event. Like, that's our PTO hours. And basically because you don't need us now, we have to use our PTO hours. No, it's not cool. So in the beginning it was nice, but now we're like, oh, hold up, we don't want to use that. So that's another thing. The whole mask situation. So when it first started, we weren't required to wear masks. Like, in the very beginning stages of this, we weren't supposed to wear masks and we didn't have to. Now we have to wear masks for the entire shift. The entire 12 hours that we are there, we have to wear a mask. When I tell y'all I can't breathe, I'm not kidding. Like, it gets hot in there, it gets stuffy, like you are smelling your own breath and everything for 12 hours. Like, it's just uncomfortable. Like, after a while, the first few days, I'm like, oh, it's not that bad, it's not that bad. No, it's not comfortable. Like, you just have it on your face all day. If you take it off, then you gotta wash your hands. Like, if I want a snack on the day, I have to go, take it off, wash my hands, put it back on. Like, it's just too much sometimes. Like, it's necessary, definitely necessary, but it's just a lot. It's uncomfortable. And then some masks that we have, people's ears are like breaking down. It's leaving marks on people's faces. Like, it's just crazy. So we have to wear them the whole shift. That's just how it is right now. So overall, when this first started happening, as y'all know, I started here at this hospital in July. Just graduated, so I am 8 months in as a nurse, and just everything with this whole pandemic is just new for me. First of all, nursing is new for me. I'm still adjusting to that. Like, I feel like I'm okay, but there's still stuff that I'm adjusting to. So to have this come, like, how the heck do we prepare for this? And a lot of nurses are like, this is new, like they've never had to deal with it. So we're all just in this situation where it's new, we're learning every day things are changing. So it's just like we have to adjust with all the changes and get used to it, and get used to it quick, because it's what we have to do. So my floor, like I said, is med-surg floors. I know all hospitals are like changing their setups to put the patients who have COVID-19 in certain places. So our hospital is trying to keep them all on one side of our hospital. So floors have been switching around and stuff. And my floor still doesn't have patients. Like, we're not taking any patients that are positive for it or are being tested and still haven't figured out if they're positive or negative for it. We just have regular med-surg patients. So anyone else who came into the hospital who needed to for an emergency, we basically have. And any patients that come back negative for COVID-19, we get. So our floor doesn't have them, but it's just like, what if they're asymptomatic and they're on our floor? Like, you know, it's just the things to think about. But it is a good thing that we don't, at least our floor doesn't have them, but we can, however, get pulled to floors that have to take care of patients who are either being ruled out for COVID-19 or they came back positive for COVID-19. And so it's crazy, because I actually got pulled to the unit, one of the units. We have a couple of units that have these patients, and I got pulled to the unit. And when I tell you, I was like, I'm so scared. Like, not even that I'm scared, it's just because it's something new, and it's like, oh crap. Like, I haven't even really gotten pulled to other floors. I've gotten pulled once, so like, this is just a lot, okay? So basically, when I got to that unit, I had to change out of my scrubs, and they provided other scrubs for us to wear, so that when we're taking care of these patients and we leave, we can leave those scrubs here and then go home in our clean scrubs that we came into the hospital with. So that's the first thing. We had patients on that floor that were rule out and have it, like they're positive for it. I had a mix of the patients in my patient assignment. So basically, we are in all full PPE, which is personal protective equipment. So we had mask on that you have to wear all day, can't take it off. And then up here on this unit, it was like a face shield. So you put it on kind of like a headband, and then there's a face shield all around your face. So basically it protects your mask that you're wearing if anything were to come, like droplet wise, to come near you, or if you're near the patient or coughing or anything, it protects. Then we have to wear gown, gloves, all that, and basically go in there with a purpose and get out of there so that you're not in there for too long. Another thing is, like, the text wise, like, they're trying to limit going in and out, in and out, in and out, because it just increases your number of chances of being like exposed to it. So what we do, what's called cluster care. So if we all need to go in there and do something, we all go at the same time, or if I can get the vitals and do what I need to do with medications, I can do that. So then that's one less person entering the room. So it's a lot of things that they're just trying to do to limit people's exposure. So when you're in there, you have all your equipment on. It's hot, okay? It's hot. So I was like, gotta do what I do and get out, because it's hot and all that stuff. So when you leave the room, you take off the gown and gloves in the room. You like unfold it so that it's none of the dirty parts are touching you. And then go out. I wash my hands. Then I put on a new pair of gloves to wipe down my mask, wipe it down while it's still on me. Then I take the mask off, clean it off again, put it in a brown bag, set that outside the room or wherever I was. and then take those gloves off and I wash my hands again. So it's just a lot of like repetition, like washing your hands, taking, like I did not want to keep going inside the room because it was just too much. So limiting the time in the room, that's key. That's basically how it was. It honestly wasn't bad. It was kind of chaotic and everything when I first got there, because this is new for everyone. Like floors are being changed into floors that the nurses, they're not used to this. They don't do this stuff. So everyone's just dealing with like change and adjusting to their new position and new patients that they're gonna have. It's just an adjustment. So because everything's not worked out, because it's all new and constantly changing every day, stuff isn't really as organized, but we just have to make best of what we can because we're all adjusting and dealing with these changes. So it was not bad to go on that floor. I made sure that I was washing my hands to a T. My hands were dry and crusty. Had my lotion, you know. It's just, you have to take care of yourself and make sure you're keeping yourself safe. So that was my experience on the floor. I didn't have any patients that were like critical or anything, so I haven't seen any of the patients that are in like critical condition, but a lot of the patients that I did have with COVID-19, they're sick, and especially the older adults. So stay home so that you can stop spreading this virus, and especially to the people who are at high risk, like the elderly, the immunocompromised, all that. Just stay home. Just stay home. These are people's family members, and it's sad. It's really sad to see. Like my heart was actually breaking up there, because I was just thinking like, what if that was my grandparent and like I can't come visit them? Like it's sad. So basically the last part I'm gonna go into is how I'm staying safe, how I am making sure to take care of myself before obviously being exposed to all of this. Because I work in a hospital, I don't get to stay home. I have to go to work. I still work the same amount of hours, still work 80 hours in 2 weeks, so I have to go to work, but I have to take care of myself and I have to stay healthy. So what I've been doing is, because I've been exposed and because I've been taking care of patients who have been positive or have been tested for COVID-19, I have to take my temperature twice a day just to make sure that I'm like on time and on spot if I start having a fever or start developing symptoms that aren't usual. I don't bring any of my work stuff home. I leave my bag, I leave my shoes. I take my shoes off before I come in the house and I have them in a plastic bag and I leave them in my car. And then once I get in here, I strip out of my scrubs, throw them in the wash, and I go in the shower. I don't say hi to my fiance. I don't know, like, what up? I gotta go take a shower. I gotta wash. I don't want to bring anything into my house. I don't want to like sit on my couch and get comfortable on my chairs and then have stuff all I strip, go in the shower. I take a long behind shower that's hot as a mug, and then I come out and I socialize, because I don't want to bring anything home and I don't want to give anything to who's living here as well. As far as health wise, my immune system has been failing me this year. I got sick 3 times already, twice in January and once in February. So I'm now taking vitamin C supplements. I have the emergency packs that if I feel something coming on, I'll take one of those. But I've been taking vitamin C every single day. I've been making sure to drink lots of fluids and just trying not to stress, because if I stress, I also like increase my chances of getting sick. Usually that's kind of what brings on me getting so sick, is me being stressed and like overworking myself. So I've been trying not to be stressed. So as far as going outside, I only go outside if I have to, like go to the grocery store. I have to get food. We try to make lists so that we know exactly what we need, so that we're not in the grocery store forever. But I did find this thing called Instacart, and it's actually like you can get your groceries delivered to you. Now I know it takes some time, but that is an option if anyone wants to look that up. I don't know the whole process and how it works and everything, but suggestion that other people are using. They deliver your groceries right to your door. As far as visiting family and friends, I have not. I'm taking it very seriously. I do not, especially because I work in a hospital, I do not want to visit anyone. I don't want anyone coming here. If you want to talk to me, if we want to talk, I've just been FaceTiming my family and friends, and that's pretty much it. It's the safest thing to do. I've been staying up to date with like the CDC, that's where you can get all the information from, and just my job emails me out things every morning and stuff. So I stay on point with checking my emails, and if I'm curious or want to know something, I just look on the CDC website. As far as being home and like trying to find things to do, I've been getting a lot of cleaning done. I've been doing a lot of more self-care than I've ever done, honestly, which is super sad because we need to be doing self-care normally, but now I've been able to have the time to like, okay, I need to do this. It's just good for your mental health, just your well-being overall is to take care of yourself, and I have been doing much better in that area. So however long this lasts, I'm making the habit now, so then hopefully when this is all over, I'm still doing the self-care that I need. Another thing is I've been getting a lot of cleaning done, like I said. We've been organizing, and then I've just been doing a lot of like just relaxing reading. I haven't really had time to read. I mean, I'm sure I could make the time, but I have a lot more time now that I'm not going out, I'm not doing stuff, I'm not constantly like on the move. So I've been reading my books, I've been crafting, I've been working on stuff because I want to ask my bridesmaids to be my bridesmaids soon. Kind of messed up everything, but I've been working on that stuff. I've been working on a lot of wedding planning, so it's giving me a lot of time to do stuff. So that I cannot complain at all. And I'm a homebody anyway. Anyone that knows me, I don't really go outside anyway. So this time is not really that bad to me, but I do miss seeing like friends and family. And then overall, I'm just staying positive. I'm not listening to the negativity. I'm not trying to let that come into my space, my home. I'm just trying to be positive, adjust to the changes as best that I can. Everyone's learning, everyone's new to this. So the best that we can do is just adjust to the changes, listen to when people are telling you to stay home, and just basically wait it out, but do what you're supposed to be doing during this time so that hopefully the time is shortened that we're dealing with this. And then overall, just being a nurse, like, it's made me really grateful because a lot of people are out of work, a lot of people are struggling financially, a lot of people are being like affected by this like hard, and it's really sad. It really is sad. So like my heart goes out to them and the families that are struggling right now and may not have the resources they need, may not have like daycares to watch their kids, may not be able to work from home. Like people who've gotten laid off or are not making money right now. Like I'm at least blessed in the position that I'm still going to work. I still have an income. I'm like, yeah, I'm where the issue is, but as long as I do what I have to do and take care of myself and stay protected, then I'm fine. But it's just like, I don't have to worry about not having my needs met due to work. So that's one thing I'm like grateful for. And then overall, this kind of just makes me like, as being a new nurse, I'm new to learning anyway. So the fact that all these changes are coming up is not too bad on me, but it is scary. But it just has made me so much more grateful, and I know that this is the career that I'm supposed to be in. Like, I can't even explain to you like the feeling it is to take care of these patients and to talk to their families on the phone, and they say like, thank you so much for all that you're doing, like we really appreciate you taking care of our loved one. Like that, the feeling that gives you and like how it's been affecting me is just like, I'm doing something that's helping this whole pandemic. Like I'm a huge part of taking care of these patients, being there. Like just me doing my job is helping others all over, and that's just, honestly, it's amazing. I know that nursing is my calling, and throughout this time it's just proven that. Like just going to work every day, like I go with such a better attitude, and if I'm not at work, I'm at home, as everyone should be. If it's not an emergency, if you don't need to go outside, you don't have work, none of that, be inside. Like you could take walks to get outside and get some fresh air, or even take like a drive, but don't go anywhere. Just stay home so that we can get through this, and we will get through it. Thank you for watching this video. I hope you liked it. Don't forget to like, comment, and subscribe. I love all my subscribers. I love you guys so much. I'm so happy that people are continuously subscribing and are enjoying my content. So don't forget to hit that subscribe button. Like, it's about to get real. And don't forget to push that notification button as well, so you can be notified when I upload all my videos. So thank you for watching. I love you guys. Stay tuned. I'll see you guys next Saturday. Bye.